Hi everyone, this is Sharon. Today I'm talking about how you can manage IBS on a plant-based diet. And I've got Kate Scarlata today. She's a registered dietitian and she's one of the nation's leading experts on digestive health and nutrition. Welcome, Kate.
Great to be here, Sharon. Thanks for having me on.
Well, thanks for joining us. Can you tell us a little bit about yourself and how you got interested in this whole world of digestive health?
Absolutely. So I started my career 30 years ago, which is crazy to believe. But about 5 years into my career, I developed, while pregnant, actually, developed a strangulated intestine. I had had a previous surgery, an ovarian cyst removed, and they believed that that scar tissue wrapped around my intestine and strangulated it. So I actually I had to have an emergency surgery. I lost about 1/3 of my small intestine and obviously began to have some digestive challenges. And my surgeon was like, go eat a steak, go. And I'm like, oh, I don't think so. So I really had to plow through the research. I actually worked with a registered dietitian that had an area of expertise in digestive health at the time. And the rest is history. And I love this area. I love helping people that have digestive challenges so that they can feel well and live their best life.
Yeah, that's wonderful. Can you tell us a little bit about the books and the resources you have so that
Oh,
our
sure.
followers can know about what you're doing?
Yeah, so I have a number of books, but of course, with any nutrition book, the latest is always the best because it's the most up to date. So the most recent book that I did is called The Low Fodmap Diet, Step by Step. It has 135 low FODMAP diet recipes. I'll talk a little bit about the low FODMAP diet in a moment, and walks the reader through the 3 phases of the low FODMAP diet as well. So I love this book because it's very easy to understand. The low FODMAP diet's a little nuanced, and we really walk the reader through it, gently introducing all these sciencey topics to make it easy for them to understand. And then I also do a blog. So if you go to katescarlata.com, I have a number of recipes, FODMAP resources, FODMAP dietitian registry if someone's looking to find someone in their area, and a number of resources and recipes on my blog as well.
Yeah, I always tell everybody to go straight to you when they come to me asking questions about digestive health. So Kate is a wonderful resource.
Thank
So
you.
can you tell us a little bit about how nutrition could play kind of a role for helping people struggle with things like IBS?
Absolutely. So irritable bowel syndrome is characterized by abdominal pain and alteration in bowel habits, but pain is always present. And for years, we really had nothing to offer patients, increased fiber, but we didn't really know what type of fiber. Some patients felt a little better, some felt worse. And then along came in 2005, the low FODMAP diet. And this diet is, the acronym is lots of crazy science words: fermentable oligosaccharides, disaccharides. These are different types of sugars. I won't even elaborate on that because you don't need to know it. But basically, it's a 3-phase diet that reduces fermentable carbohydrates that cause gas and pull water into the gut and can trigger symptoms. And the evidence now, I think we have 7 randomized controlled trials showing that overall, the low FODMAP diet helps patients. Anywhere from 50 to 70% of patients with IBS will feel effectively managed with this nutritional approach. I do think it's important to understand that not everyone, 50% might not, or 30 to 50% may not. And most patients that I work with, diet is a piece of their puzzle. It's not the entire puzzle. So we want to encourage good stress management, gentle exercise. We'll talk about supplements in a little bit. So there's a number of different treatment modalities that can get the person feeling their best. And diet may be part of it, or it may be a big part or a little part. It's very different per patient.
Yeah, that's great advice. So can you tell us a little bit about the low FODMAP diet and just, generally how it would work if people are interested in
Absolutely. So it's really a 3-phase diet. The first phase is the elimination phase, and this runs 2 to 6 weeks. And during that phase, we're removing all the high FODMAP foods from the diet. And there's a lot of different foods that are low in FODMAPs and a lot that are high. The big high FODMAP foods include things like onion and garlic and wheat, which are difficult for patients to remove from their diet. But the elimination phase is really just, it's almost a diagnostic tool. We're just seeing if you respond to the diet. Does it help you? Are you sensitive to FODMAPs? So 2 to 6 weeks. The next phase is called the reintroduction phase. And during this phase, which can take about 8 to 10 weeks, we're reintroducing FODMAPs systematically into the diet to really help the individual identify their personal triggers. And this varies person to person. And the last phase is the personalization phase, and that's when we gently add back those FODMAPs that the patient was able to tolerate. So if they can tolerate a little bit of garlic and they can tolerate wheat but not onion, we would gently add a little wheat pasta with a little garlic and see how they do with that. So that's the main way that you present this diet. But there's also another approach that dietitians have been incorporating and has recently been sort of in the literature, and that's called the FODMAP gentle approach. And in this case, instead of getting really micro with all the FODMAPs in every food group, we're really looking at the patient's diet and we're identifying where they're getting the bulk of the high FODMAP foods, foods that are very rich in FODMAPs, and we're only really removing those. So we often call that cherry picking out the FODMAPs. It's recently been described in the literature as the FODMAP gentle approach. And I really like this approach, especially for plant-based diet followers, because we can really just say, wow, you're having onion 5 times a day. Let's dial that back. And that may be enough for some people. So the dietitian can kind of work with the individual and decide which approach works best. You know, if I was working with a child, someone that didn't really want to change their diet too much, a FODMAP gentle approach is a perfect way to go. And it's less restrictive and disrupts, you know, your life a lot less. So I like that approach. So there's 2 ways to go about it.
Yeah. So how would someone start doing a low FODMAP diet? Should they find a regular dietitian to help them with it? Is that what you
Absolutely. And you know, there's not enough of us to go around. So that's the reality. If there's a dietitian that you can get referred to in your area, and you can look on my website to find if there's someone there, highly recommend it. It's a very nuanced diet, and the dietitian can give you tips on menu planning, grocery, brand names, just things that make the diet so much easier to follow. Additionally, they're going to be looking at your diet to make sure you're meeting all your nutritional needs. That's really important too. That you're eating enough calories, which will help maintain the motility of your GI tract, that you're doing all the right things to help you get better. So dietitian first and foremost. If you live in a remote area, you can't afford a dietitian, I would say that you could use the Low Fodmap Diet step by step, and it'll give you a lot of that information to engage in the diet. So that could be a good plan B. I like the dietitian approach. That's how the research has been done with the Low Fodmap Diet, but I also realize there's some limitations around that depending on where you live. And you know, if you have the money to put out, if your insurance doesn't cover this.
Right. So you know, I'm really interested in plant-based diets, and a lot of my followers follow some sort of a plant-based diet, whether it's a vegan diet, a vegetarian diet, or very, very focused plant-based, like a flexitarian or semi-vegetarian diet. So is it possible for people on those diets to manage IBS, and what are some of your tips on that?
Absolutely. Like I said earlier, I think that when you look at IBS, you have to look at it from a number, not just diet.
Mm-hmm.
We can absolutely minimize FODMAPs in a plant-based, vegan, or vegetarian diet. No problem, we can do that. I do recommend, however, if someone's following a vegan diet and requires a lot of legumes to maintain their protein intake, legumes as a general rule of thumb, there's some examples which I can talk about in a moment, are high FODMAP. So if you're following a vegan diet, my general rule of thumb is no longer than 2 weeks on a low FODMAP elimination diet. And you would want to be very careful with including foods for protein. Like firm tofu is low FODMAP, silken tofu is high FODMAP. Some canned legumes like chickpeas and lentils tend to be lower in FODMAPs. Red kidney beans have very high FODMAPs. So working with a knowledgeable dietitian so you can pick and choose the foods just to bring down that FODMAP intake to a level that hopefully will provide some symptom relief. And as I mentioned before, gentle exercise, there's supplements that you can take. There's also gut-directed hypnotherapy that can be very helpful. In fact, gut-directed hypnotherapy is a special hypnosis that has been proven to be as effective as the low FODMAP diet in certain individuals with IBS. So you really want to look at all types of approaches to managing symptoms, depending on your diet needs.
Are there any other nutritional concerns that you think people need to factor in if they're eating a plant-based diet and they're trying to manage IBS?
Definitely. You know, some of the plant-based foods are also very rich in what we call anti-nutrients or oxalates. And these aren't all bad, but they can inhibit or reduce the absorption of certain minerals. And zinc has a big role in gut health. It helps with the permeability, sustainability sort of the gut. It also helps manage diarrhea and needs to be replenished if someone is more diarrhea predominant. So if you were eating a diet very high in phytates, which would reduce zinc, you could be at risk for zinc deficiency. So in someone that came to me that was vegetarian or vegan, had diarrhea, I would check their zinc levels, and I would just make sure that they incorporate adequate zinc. They may need a supplement, but incorporate adequate zinc through sunflower seeds, firm tofu. There are a number of plant-based sources that also, you know, will increase their zinc. It's estimated, I think, that individuals that are following a plant-based diet may need 50% more zinc than someone that isn't. So just to have that sort of red, you know, lighted, calcium, making sure you're getting adequate calcium needs, because of course, you know, oxalates will bind that. So choosing kale versus spinach, you know, these are things that a dietitian can help, which I really think is important if you're not that knowledgeable about the vegan or vegetarian diet, again, to consult your website and resources, but also a personal dietitian if possible.
Yeah, I think that's a great tip, because as people start learning about their triggers, they can see the areas that they're maybe, you know, a little bit of a shortfall on a particular nutrient they need to make sure they're getting. So zinc is one, as you've mentioned, and calcium, making sure they're getting plant-based calcium sources. Maybe they need to take a supplement if they're, you know, if they're not going to be meeting their needs. That might be another direction they need to go.
Absolutely. There was one recent study with celiac disease patients where they assessed zinc, and 60% of these individuals were deficient in zinc. So I think it just goes to show that it's important that we're monitoring these micronutrients in people, not necessarily due to diet constraints, but due to their GI disorder that may be contributing to some malabsorption or maldigestion of some of these nutrients.
Yeah. So you mentioned a few foods that were higher in FODMAP. Are there any other plant-based foods that might be triggers, common triggers for people on a plant-based diet that you can think of?
I think probably one of the biggest one is, you know, and it's sad because soy milk was probably the most nutrient dense of all the plant-based milks, but most of the soybean milk in the US is made with the whole soybean. And their FODMAPs are water soluble, so they're going to retain in that milk. And so most soybean milks can be a problem. So that's probably, I had one Starbucks barista come in, and that was her big item. And once we switched her out to almond milk, she was good to go. She was not vegetarian, but just preferred the soy milk flavor. So in her case, it was really, we didn't have to do a full-fledged diet. It was like, this is so copious in your diet. Let's just try this and see if that makes a difference. And it was enough.
Wow.
So silken tofu, onion, garlic are the big ones. There are some vegetables that tend to be a little bit high, such as artichokes, Brussels sprouts. There are some foods like strawberries and carrots that have no detectable FODMAPs, so though you can be a little bit more lenient with those.
Yeah.
But on the flip side, there are so many fruits: strawberries, blueberries, pineapple, cantaloupe, grapes, unripe bananas, like just ripe bananas. They're all low FODMAP. And kiwi fruit is another good one, which can be helpful for constipated patients. And then vegetables, all sorts of salads and green beans and eggplant and zucchini and spaghetti squash and spinach and kale and collard greens. And so there, there's so much good that you can also have on the diet. And the important thing is it is not a forever diet. This is really, learning diet and figure out where that sweet spot is for you. So you have a good food related quality of life, balanced diet, but you're managing symptoms to a level that's helpful for you.
Right, because it's very unique, right? It's really dependent on your own personal triggers, correct?
Absolutely, and probably in part we're learning more and more is very related to the type of microbes that inhabit our gut. So, and that's a personal fingerprint. So everyone will be a little bit different. The other thing that's important to know is that tolerance to FODMAPs can change, just like the bacteria in our gut can change. So you may have onion as a trigger for a little bit and then learn as things, you're having a good day, you're not flared, and you can have a little bit of onion without, major symptoms. So to always retest and calibrate where you are with your FODMAP tolerance is also really important.
Yeah, and that reminds me of a conversation you and I had previously where you talked about when you're inflamed, you have a different approach than whether you're in a really nicely managed controlled state, right?
Absolutely. When I know when my gut's like up in a bunch, I'm like, okay, I'm just going to go low FODMAP, even if it's for a day or a meal even. And I find things settle down and then I can kind of go back to my normal baseline. But it really comes down to like listening to your body. It's just like the same with exercise. If it feels good, do it. If you're miserable doing it, then maybe that's not the right activity for you. It's really the same with the diet. I think sometimes we ignore our body's messaging that's saying, ouch, this hurts. But like, I still want it. And you have to decide, well, is it worth the pain? Just go in with your eyes wide open. But try to listen to your body a little bit more carefully, and you probably will be managing your symptoms a little bit more effectively too.
Yeah. So one of the questions that I have is about fiber, because I get a lot of questions on this. And, a plant-based diet tends to be very high in fiber, and there are different types of fiber. So can you talk a little bit about fiber and IBS and a plant-based diet?
Absolutely. I think when it comes to fiber, it's a very complex sort of group of different types of fiber. It's not just fiber. So there's fiber that's soluble in water, means it mixes with water. There's some that's insoluble, it doesn't. There's fiber that is highly fermentable, and then there's fiber that's very, very little fermented in the gut. When we say fermented, this is basically fiber is eaten by our bacteria and they produce gas from it. So insoluble fiber is found, the skin of fruits and vegetables. It's also in some whole grains. For instance, it's in the wheat bran part of wheat. So if you think of wheat has a number of different types of fibers. It has some FODMAP oligosaccharides called fructans, which are a water-soluble fiber, and it has wheat bran if it's a whole wheat bread. The wheat bran is insoluble. It irritates the gut. So if you have too much wheat bran, it actually mechanically irritates the gut, encourages mucus secretion and bowel motility. So for someone with diarrhea, wheat bran probably not a good idea. A little bit of wheat bran can encourage GI motility. That might be really helpful for someone with constipation. So the other types of fibers, so for IBS patients, we reduce these short chains, so they're small fibers that are virtually fast food for bacteria. And those are the fructans and the galacto-oligosaccharides. So fructans, onion, garlic, wheat are the big ones. You can find a little bit in artichokes. Those are the kind of the big ticket items. And then for the galacto-oligosaccharides, your audience is probably very aware of this. This is the type of fiber that's in beans. And like I said earlier, it's not that you can't have galacto-oligosaccharides or you can't have fructans. It's reducing them to a level that works for your body. So when you talk about fiber, fiber is important. It maintains the gut barrier function. If bacteria are not getting the fiber they need, they will start eating the lining of the intestine, because that's also carbohydrate or has some polysaccharides, and will make it permeable, which is not a good place. That's not where we want to go. So we want to have adequate fiber, but too much fiber could aggravate things, because when we look at food, it's not like, oh, this is insoluble fiber, this is soluble fiber. Most foods have a combination of fibers within them. So for my IBS patients, I tend to reduce the FODMAP fibers, the fructans and the oligosaccharides, which are, again, wheat, onion, garlic, and reduce the beans, and wheat bran. So anything, and whether they can tolerate some insoluble fiber, I would say most of my patients can, but I tend to give them more soluble fiber in the form of longer chain soluble fibers, which are a little less fermentable. I know it's getting a little sciencey, but oatmeal, for instance, has a long chain fiber, and that's very well tolerated by my patients. So oatmeal is a great IBS food source. Small amounts of canned chickpeas and lentils. If patients are really troubled by the insoluble fiber, those are mostly the diarrhea predominant patients, I might encourage more cooked vegetables than raw, but again, it's very individual. I never suggest, well, I shouldn't say I never suggest, but the majority of IBS patients can tolerate raw vegetables. Would I have them have a salad the size of their head? Probably not. It's finding the sweet spot and what works. So, you know, lots of different sort of terminology within fiber. It can be fermented. Fermentability is a factor. How long it is a factor. Whether it's insoluble or soluble is a factor, and how it can impact digestive symptoms for different people.
Right. That's really helpful. So, you know, when I'm talking about this with you, I really start thinking about plant proteins, because, you know, that's always a challenge for people on a plant-based diet to make sure they're fitting in those plant proteins. So then, you know, the legume category is a big source for a plant-based diet, which you talked a little bit about. Are there other kind of low FODMAP type plant proteins that you think that you could recommend? You talked about some of the lower FODMAP legumes. What about nuts and seeds? You talked a little bit about pumpkin.
I know. Yeah, I was thinking the same thing, actually. I was like, you know, I really haven't addressed that. So cashew nuts and pistachio nuts tend to be very high FODMAP and problematic for many people with IBS. Now, does that mean that you can't have two cashews in a mixed nut dish? You probably could. But sitting there and using cashews as your primary source of protein on a salad, probably not a good idea. So in general, nuts have a variable amount of FODMAPs. A handful of peanuts is fine. A handful of almonds on a salad is fine. Sunflower seeds, chia seeds, pumpkin seeds, hemp seeds, flax seeds, you know, around a tablespoon or two of those per meal is a good amount. You wouldn't want to go too high. And I would say that, you know, things like flaxseed and chia seeds are so high in fiber, limiting that around a tablespoon per meal is probably a good amount for most IBS patients. It'll give them a nice source of fiber, but allow their body to digest it. They could have another tablespoon later in the day if they wanted to, but like per meal, they should kind of limit it to that. Okay. So because FODMAPs, we recommend that you don't overdo it at one meal, but that doesn't mean if you've had, like, for instance, the cutoff for chickpeas is around a quarter of a cup of canned chickpeas. That maintains it a low FODMAP food. If an individual wanted to have a quarter of a cup of chickpeas at breakfast, at lunch, and dinner, that would be okay. Yeah. So it's just spacing it out so you give your body a chance, so it's not all coming into the colon at one time, providing, you know, a big party for those microbes.
That's great. So what about other strategies? You know, you're reading about peppermint oil and probiotics. Are there any of those things that you would recommend for managing IBS?
Well, I think, the science, again, is complicated with probiotics. There's a number of mechanisms that we believe probiotics would be helpful for an individual with IBS, help changing the gut microbiota, the microbes that live in our gut, affecting the immune function, because probiotics are shown to strengthen our immune function in our gut. Reduce that sensitivity in our gut may occur with probiotics, but it's individual. So when you look at the bulk of science looking at probiotics and the benefit in IBS patients, it's kind of low benefit. It's not highly recommended because the data isn't across the board. It helps everyone, but it does help. They do help some people. So what I recommend to my patients, if they want to try that, then we select a probiotic based on their primary symptom, whether it's abdominal pain or bloating or constipation or diarrhea, that has evidence in the science to show benefit. Like Activia yogurt and Align have some benefits with reducing overall symptoms and constipation. So I might go there. There's a good resource. It's called the Clinical Guide to Probiotics, and you can get it in the US online and as an app. And that gives you really good ideas about different probiotics based on the symptom that you're trying to manage. So if a patient wanted to try that, I'd say, we don't know if it's going to be helpful for you specifically, but given that you have this symptom, we could certainly try it. If I'm going to do the low FODMAP diet with them, I'm going to not mess around with probiotics at the same time though. So you want to do one variable at a time so you know what's working and what's not working. So yes, probiotics can be helpful. The science looking at prebiotics, which are not probiotics, but are actually, food source for the bacteria that live in the gut that are helpful. So helpful food sources. It can be anything from plant chemicals to fibers. The data hasn't been as strong with that in IBS. Some patients do seem to respond to prebiotic supplements, but it takes them a little while, like up to 12 weeks for their body to kind of adjust. And then at that point, some of them do find that it's beneficial. I think we have a little way to go with prebiotic supplements, but I think that's the area that we should be paying attention to. I think prebiotics are going to be more helpful for people with IBS than just adding transient bacteria via probiotics. That's the way I'm seeing the future go. And I say that because we've seen a specific prebiotic in individuals with lactose intolerance, for instance, and over time, those patients with lactose intolerance, so pain and symptoms with lactose, with this prebiotic, they don't have those symptoms anymore. So we know the microbes play a big role in symptoms. And so if we can change them by feeding the right ones, I think that will really will be the future, part of the future of IBS therapies, but we just haven't found the right ones yet.
Yeah.
I think that's an area that we should all be paying attention to. Peppermint oil is another supplement that has really pretty strong research suggesting that it helps with abdominal pain and IBS symptoms. Easy to find at the grocery store. Pepogest is a brand I commonly recommend. I encourage an enteric-coated one because you want it to be digested through the stomach. You don't want to have the peppermint oil released in the stomach because sometimes it can cause reflux and make you kind of burning in the esophagus. So enteric-coated peppermint, take it as directed, and that can be really helpful. Another supplement that can be helpful is the alpha-galactosidase. I think I'm saying it right, but Beano or Bean Assist. A lot of the Beano products actually have mannitol in them, and mannitol is a FODMAP. So I recommend like Bean Assist. There's other products that have less additives that you can get easily online. But there's been research to show that using the bean, the alpha-galactosidase, so if I say it right, actually reduces symptoms in individuals with IBS when they do eat bean and legumes that have galacto oligosaccharides. So I think that's definitely worth a try. And the same goes for lactase supplements as well. So if for an individual that wanted to try traditional yogurt, a vegetarian, didn't tolerate it as well because there's too much lactose in there, they could try a lactase supplement. Again, lactate supplements have sugar alcohols added for the most part as well. So we usually add we suggest other brands that don't have the FODMAP ingredients. I think it's Nature's Way has a lactase supplement that could be suitable. Yeah, so there's a number of other things that we can add to the diet or supplement to affect some of these end game symptoms.
This is so great, Kate. You are just a wealth of knowledge when it comes to IBS and plant-based diets and FODMAPs, and I highly recommend everyone to go check out Kate's site, her books. I mean, it's just a blueprint for how to handle this. And I appreciate you because you've helped so many people improve their quality of life through diet, which is so important. So I'm going to be including all your resources in the notes of this interview on the blog. So please make sure to check it out and check out Kate's website. And thank you so much for joining us, Kate.
Thanks for having me, Sharon. I really appreciate it.
All right. Have a great day.
You too.
Bye.